So if you have to do a trigger point release for your pelvic floor, this commenter is asking, how do I locate my trigger points and make sure that I am doing the right thing? Because you don't want to hurt yourself. That is a very fabulous question. If you don't know, I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years, and pelvic pain is something I treat. Pelvic pain is something that has many different causes, but oftentimes women that have pelvic pain will have what's called trigger points, which is a hyper-irritable muscle fascicle. Basically, it is a knot within that muscle. Specifically, muscles in your pelvic floor are the levator ani, and obturator internus is a deep one, deep inside, that is associated with pretty much all pelvic pain. So some of my patients do internal releases on their own with a wand. A wand such as this by Intimate Rose is an example. One side goes in, the little pointy part, and then the other part is a handle. Now, I tell my patients, if you are doing your own internal release at home and using a wand, we start very small and gentle. And I tell my patients to envision a pelvic clock inside. So like 12, 3, 6, 9. So you are going to gently find a spot that is uncomfortable, and you're going to hold it for 10, 20, 30, 60 seconds, just gently. Because if you put too much pressure on a hyper-irritable muscle, you can exacerbate it. But the goal is we want to relax those trigger points. We want to put a gentle pressure holding it. So while maintaining that pressure for 10, 20, 30, 60 seconds, whatever you can tolerate, I want you to breathe. Do not push so hard that it hurts badly. You might feel that that's the spot. Hold that right there. Wait for it to soften. Now, I did have a patient the other day have this exact wand. She is not very good with awareness, body awareness or sensation. And yeah, you're right. She irritated herself as she pushed way too hard, way too long. I think the best way to start is to be gentle. So you're gonna do just maybe 1 or 2 spots. I never have any of my patients start anything and go all in all at once. I will oftentimes have people begin by making sure they can even massage the opening in the shower, like 5 strokes, just making sure that is pliable. And then gently go to the different layers. So start slow, be gentle, just a little bit. Now, some people can't tolerate it every day, so 2 or 3 times a week is ideal. Every day is somebody like who has tissue that has been fried by radiation. If somebody's had like cancer or colon cancer and they had radiation, they need to sometimes do this daily because their tissues can withstand it. But if you are hypermobile, if you are freshly postpartum, you've got to be really gentle to those tissues. I always think about the tissues of the pelvic floor, like the under eye tissues, you know, that they tell us when we're putting on eye cream to like not like just use our finger, like to use your like ring finger to gently pat it in. I think of the pelvic floor like that. I'm nice to the tissues. I hope that helps.